here. I'm going to take you through a little flow with minimal reps, but you can do this as many times as you want. Just watch the video again if you want to continue it. But it's for the lower back to strengthen some of the tissues gently that can help to alleviate lower back pain. The exercises I'm going to show you are ones I can't take credit for. They're really well known physio exercises that have been given to me over time when I've had lower back spasms. So when the muscles have like sort of tensed up and gripped and I found myself on the floor for a few days, not really able to move. These are the ones that I've started with really gently, minimal range of motion or just to the degree that feels good for you. And they slowly help to increase mobility, relieve muscle tension, so that really like that feeling like nothing can relax, and increase your core strength. For me personally, my lower back issues have come from either my abdominal sort of core and glutes being too tight and unable to relax, or times when they've been weaker, like sort of 6 to 8 months after having babies, when I've been trying to get back into exercise and I've overdone it. So you can lay down on your back. We'll get started. And the first thing we're going to do is a neural glide. So with the sole of your left foot on the floor and your left knee bent, just stretch your right leg up toward the ceiling to your degree, holding the back of your thigh. You can take a few ankle circles here, so you might have a fairly decent bend in your knee. If you can stretch your leg all the way up, then do that, but have as deep a bend as you need. And then circle your ankle the other way. If your ankles are a little bit jammy, then it might feel more like a rectangle, and there might be areas of the movement that feel jerky, and that's okay. Just notice it. And from here, flex your foot toward your knee or your face. Press your heel up to your degree so you feel a stretch through your calf and down into your hamstrings. And then bend your knee. Inhale, exhale as you press your foot back toward the ceiling. Just do that 3 more times. Inhale, you can even relax your foot a little bit, and exhale, flex your toes toward your face. 1 more. And from here, support your leg if you need to bring the sole of your foot back down to the ground. Bring your knees together and feet together, hands to hips, or belly can be a nice stabilizer. And then gently draw your lower abdomen down away from your hands and find a little bit of a press of your lower back into the ground, just as much as feels right for you. Real big focus on intuitively doing things to your degree here. Press the sole of your left foot into the ground, and just bring your right knee out away from center and draw your belly in. Exhale, bring that right knee back in. So inhale the knee out, exhale the knee back in. Do that 2 more times. Staying with the right side, you're bringing that knee back in, and then it's a heel slide. I don't like to run my heel along the ground because my yoga mat is sticky and it feels jerky. You can keep your heel on the ground, or as you slide it out, you can float it just off the floor. You're only going out to a degree that feels okay for your back. So if you're only going a little way out and back in, that's fine. I want you to think about drawing your belly in as you bring the leg back in. Just 2 more. Hug muscle to bone around that right leg. And really think about lower abdomen strong. Okay, from here, we're going to cross the right ankle over the left thigh, figure 4, and gently pulse your knee away. So press it with your hand a few times, or for as long as you like. You can pause this at any point if any of these exercises feel like just the thing you need, just pause the video and continue with that exercise until you're ready to move on. From here, either stay with the figure 4 and press the knee away, or you could draw that figure 4 unit in towards you, holding the back of your thigh. So your right arm will go through the middle of the 4, and then you'd find your left hand and the right hand joining at the back of the thigh. And just take a few breaths wherever you happen to land. Active through your feet. Sole of the left foot comes back down to the ground, and then use your hands, right hand to the knee, left hand to the foot, to pick your right leg up off the left, keeping that figure 4 position with the leg though, so you've got a bend in your knee. Dial your toes toward the ceiling. So when you look at your shin bone, it should be attempting to dial itself toward the sky. And then just take your leg across your body, hold it for a breath in. And then breathe out, come back out to the side. Inhale over. Stay here as you exhale. Stay for another breath in. And then take it out toward the right side of your body. One more time across the body. Hold it here. Exhale. Press your hand into your foot and your foot into your hand. And then slowly release. Okay, from here, you can choose to take a little bit of a figure 4 rock, maybe just a little bit of motion through the pelvis. Or you could take it out into a twist, so that whole figure 4 unit moves toward the left. The sole of your right foot finds the ground and your left knee is just holding it in place. Right arm reaching out to the side. Might feel like a nice shoulder stretch, and even if you let your left ear drop toward the ground, that might intensify the stretch a little. So this twist is really only for if you're not experiencing anything acute. If you've got a lot of pain, stay with just a regular little figure 4, maybe a rock side to side, but not taking yourself all the way into the twist until you're feeling a little bit more open and free. Coming back to center. Stretch that right leg up toward the ceiling. Point and flex your toes a few times. And then bring the sole of that foot back to the ground. We're going to do the same thing on the left. So first the neural glide, right knee bent, left leg stretched up toward the ceiling. And we'll do some ankle circles, to start with. Change directions. Maybe it's more like a rectangle. You can break the sides of it down into discrete movements if that makes more sense for your brain and body and that connection. All right, stretch that heel up toward the ceiling and then bend and extend. You can keep a bend in your knee the whole time. You don't have to straighten the leg fully. Sometimes tight tissues and nerve tension through there won't allow it, and that's cool. One more, hold it. And then bring the sole of your foot down. We're going to take our bent knee fall out. Bent knee moving out to the side with control. Holding onto your hips, draw your belly down away from your hands. And then left knee just to your degree out to the side and back in again. You want to make sure the back of the right hip is still pressing down into the ground, and you'll need to draw your belly in to ensure that happens. So that's a good way to think about engaging your abdomen here. Right knee stays still, last one. Now we've got our heel slides, so you could slide along the ground or float the leg in. You tap your left heel next to the right heel as you bring it back in, and then you float the leg back out, hugging muscle to bone, and again, abdomen drawing in. Last one, inhale the leg away, and exhale the leg back in. Beautiful, let's take figure 4. So to start with, just right foot stays on the ground and you're pressing with your left hand into your left thigh and pulsing that leg away from you, mobilizing your hip joint. External rotation at the hip is where we're at the moment. And if that doesn't make much sense to you, there's a really cool app called Essential Anatomy that I've had for a long time. And it's a beautiful way to sort of visualize and layer up the muscles and the bones and see how they all work together. completely zero incentive for promoting that app. I just love it. All right, from here, if you want to stay just pressing the leg away, stay like this. Or even if that's too much, just stay in this position, really gently unforced. Otherwise, you can draw a figure 4 in towards you, hold on to the back of your right thigh, or you could hold your right shin bone if you're feeling pretty open and you're just doing this for a bit of nourishment and prevention rather than treatment. So another couple of breaths. Sole of the right foot back to the ground, and then you can take a gentle rock from side to side. So what this actually is a rotation through your spine and finding a little bit of freedom through your rib cage. If you want to stay with the rock or even just with a still figure 4, that's fine. Otherwise, you take that whole unit and it falls over toward the right hand side. The back of your left hip will peel off the ground. All the weight will be in the right hip. But try and anchor down your left shoulder as best you can. It's okay if it does come up off the ground, honestly. And then just look towards your right. You can even hold on to that ankle if your body's dimensions allow it. And take a few good breaths wherever you happen to have landed. All right, come back through center. So from here, we're just going to roll over onto your belly. Cobra is a really popular exercise that is prescribed to help strengthen the back. However, if you're experiencing some pretty severe symptoms, then you might not want to go straight for a cobra. But what you can do is find a bit of a pelvic tilt and pelvic rock. And we haven't done any bridges. I'll do that in a different one and we'll go through some bridge variations. They are amazing for your lower back and sort of glute strengthening, so muscles around the backs of the hips. But for now, we're just going to stack one hand on top of the other and then bring forehead to hand. Elbows are out wide, tops of your feet are pressing into the ground. And then just lengthen your lower back. Think about pressing the fronts of your hips down into the ground and take a nice breath in here. Stay for the breath out. And then inhale, relax your belly into the ground to your degree. Exhale, lengthen the sides of your waist, lengthen your lower back, draw your belly up and in just a little bit. And then relax your belly into the ground. All this is a pelvic tilt, really. So you've got a posterior tilt as you lengthen your lower back, feel your belly lift and your hips press down. And then inhale, anterior tilt just a tiny bit, maybe even keep some neutrality around that. And then one more time, lengthen, breathe out, lift your belly, press your pubic bone down. And inhale, relax. I want you to take 3 really good breaths, just really focusing on letting your abdomen relax and your rib cage expand as you breathe in. And then breathing out, soften the outsides of your thighs outwards. Do that 2 more times. From here, bring your arms to the ground beside you. So you've got cactus arms. Right ear to the ground. Take a breath in here. And then a tiny little lift through your upper back. Think shoulder blades drawing back. Eyes are still at the ground. You don't need to lift your head or chest super high. And then inhale, turn your head left ear to the ground. Exhale, lift and look through center. Inhale, right ear down. So we're mobilizing the upper spine now. Exhale, lift. Inhale, lower. Elbows are about in line with your shoulders. Keep moving like this from right to left. One more time, ending with your left ear on the ground. And then lift a little bit. Bring your hands in beside your chest, tuck your toes, press up or come up any other way that you need to take care of yourself. And then you're just going to set up with your knees under your hips, your wrists under your shoulders. Lock out your arms, please. Don't bend your elbows unless they kind of naturally have a bit of a bend. We're mobilizing the upper back here. Shoulder blades draw back and then press the ground away. So it's a retraction of the shoulder blades as your chest drops, and then a protraction of the shoulder blades as your chest lifts away from your thumbs. It's good for the shoulder blades, the muscles that connect them to your spine, and it's also a really lovely one for a bit of thoracic spinal mobilization. We think about the lumbar spine a lot, but its connection, obviously, with the rest of your spine is undeniable. You've got to take care of the whole lot. Hold it here, find a nice neutrality. And then all you're going to do is slide your right leg back. Toes stay on the ground. Press into your left shin and lift your ribs away from your thumbs. And then bring that right knee back down underneath the hip. Switch the pressure into your right shin and slide your left leg back. Bring it back in. You're going to do that 3 more times on each side. The transfer of the weight means that you need to recruit your abdomen to try and keep most of your body pretty still. Keep pressing evenly through both hands. Lost track of where we're up to, but I think we've still got 1 more each side. Beautiful. Take a little gentle happy cat and angry cat. Stretch out any part of your back that feels like it's able. And then from here, watch this video and repeat it as many times as you like. Don't overdo it. Take care of yourself. But a couple of times a day might just assist in decreasing some tension and easing some of that gripping. So I hope you enjoy this, and like and subscribe and share. Thank you.